So they get a distemper vaccine too, but this one is called, if you look on the bill, FVRCP. And this stands for feline viral rhinotracheitis, calicivirus, and panleukopenia. And these are some pretty yucky diseases too. Upper respiratory diseases. Diseases cause high fever and pain. In the case of calicivirus, if you see Lapis hanging out with me today, that's my cat. She had to experience that. She was miserable. And panleukopenia, which is the cat version of parvovirus. And so the schedule for distemper is we start the vaccines a little bit later in cats, and we start that at 8 weeks of age. Every 3 weeks to the age of 4 months. Booster 1 year later. Every 3 years thereafter. The other vaccine that's really important is rabies. Rabies is given similar as it is to the dog. Same schedule. We give it about 12 to 16 weeks, and then once every, then 1 year later, and then once every 3 years. And those are the core vaccines for cats. For elective vaccines, there's feline leukemia vaccine. And some doctors will vaccinate kittens, all kittens for it, because it is unfortunately pretty common. This is an disease of the immune system, and it is transmitted through the mama to the fetus. And sometimes, unfortunately, we don't see it on a test until 6 months of age. And so with that in mind, there are veterinarians who do vaccinate for them in kittens, and there's nothing wrong with that. For me, typically, I don't vaccinate for leukemia unless they're going to be outdoor cats, because that's when they're going to be exposed to it, or if they happen to live with a leukemia positive cat. And that's going to be 2 vaccines 3 weeks apart, and then you booster at a year, and then the leukemia vaccine is every year. Lastly is the FIV vaccine. This is feline immunodeficiency virus. So yeah, cats can get AIDS, but honestly, FIV positive cats live for a very, very long time, and usually you're going to die from something else. They usually, as long as you're maintaining them and you're taking care of any infections that come across, they're probably going to be okay. My concern with the FIV vaccine is that if you were to vaccinate your pet for that and then you do a test, it's going to show up positive, which means if your cat's outside and gets picked up and they test them, they're not going to know the difference, and that can be a death sentence. So not to sound, hyperbolic and whatnot, but I do not recommend the FIV vaccine. So there is a thing with cats with vaccine-associated sarcoma, and what that means is that there has been cases where vaccines can cause cancer in cats. That doesn't mean stop vaccinating your cats. It just means we do things a little differently. I have not seen a vaccine-associated sarcoma in many, many years, because the formulations have changed a bit to make it so that it's not as likely to cause an issue with the cats.